Good morning and good afternoon and welcome. I'm Jim Pursley, president here at Hinge Health, and we're here today with the inaugural launch of Pain Points, a fresh perspective on employee benefits, an ongoing series where I'm joined by leaders across industries from retail to travel, manufacturing, and beyond to explore topics at the intersection of healthcare, technology, and innovation. Today, it's my pleasure to be joined by Dr. Ren Brown, Vice President of Medical Affairs and Clinical Strategy at Whole Foods. Thank you for joining us today. I'd like to start by letting the audience get to know you a little bit better. Can you share what led you to start practicing medicine and how a primary care doc wound up at Whole Foods?
Yeah, thanks, Jim. Thank you for having me, by the way. I appreciate it. I love people. I love problem solving as a team. I love medicine and science, always have. I love primary care. I'm board certified in internal medicine, care for adults and pediatrics. I also have a passion for proactive care. I started training to be a pre and post transplant primary care provider where you had to be very proactive, keep those who are immunosuppressed from getting sick. I realized very quickly, early 2000s, that there was a need for more proactive care approaches within general primary care. At the time, primary care was sort of looking for, what it was going to be. And so I started my own sort of proactive primary care practice and company in 2005. Whole Foods Market looked at my approaches to treating people in around 2013. And so I joined them in 2014 to help them develop their brick and mortar primary care practices. And I had the privilege to be a part of a creative and insightful team that then began to understand that to provide and scale our proactive whole person care vision throughout the entire spectrum of clinical need, we'd need to start our own health plan and care management approach. So did that and then became the vice president of medical affairs in late 2019, early 2020.
Fantastic. Well, today, as you know, we're going to explore modern healthcare strategy for a modern business. And even before the Amazon acquisition, Whole Foods, I think, could be characterized as a modern business. And so let's start with just a little bit of background for the audience, although I think Whole Foods is pretty well known to many of us. You are a large grocer operating more than 500 retail stores across 44 different states, and you serve over 91,000 employees. So as vice president of medical affairs for an organization of that size, what are you most focused on for your people and for the enterprise?
Yeah. Well, my mission is to have all Whole Foods team members feel as if they have a trusting and healing relationship with a caring provider within the company. I'm a doctor, so that's the where the background I come from and my bent, if you will. So I can't be a primary care provider for all of them, obviously, but I can follow the same sort of care plan that's helped me and so many of my patients in the past. And that sort of mantra has been listen, then serve, then empower. So first, listening and hearing our team members, that's through personal interactions at the stores or meetings or emails, through surveys we do, or through data. Listening, hearing, and really hearing them and their needs. And then, of course, serving. I serve today by linking the clinical with the corporate. Right. I'm the bridge, if you will, by working with other leaders to create wellness offerings, benefit designs, risk strategies that make good clinical sense and meets the needs that I've heard. Advocate for team members and help leadership understand how to deliver quality care. And our leadership has been amazing in their response to those needs. Once you've listened and served, the amazing thing is then you create this trusting and healing relationship with team members, our employees, and you can empower them. Only once you've listened and served, you have the opportunity to educate someone and help them understand how to change their lives, live the brand, live wellness approaches for a healthy future. My patient population, if you will, team members is generally tend to be in their 30s, all races, genders, more urban. We're in US, Canada, and the UK. And we do have a wide range of whole people, and I look to serve them all. The naming I use, sometimes I call myself the family doctor for the Whole Foods family, or using the team member nomenclature we do for employees, I sort of sometimes say I'm the team doctor for the Whole Foods team. My care plan is to see each individual team member, we say, as a unique and whole person, to offer services that meet their needs, to help them live our brand of well-being and to help them live whole. So I'd like each team member to actually become healthier as they live life with us.
Yeah, yeah. Well, let me just take just pause for a second to say thank you, Ren. First of all, you think about that team doctor approach. Your team was on the field, for all 60 minutes through a global pandemic when a lot of folks weren't. And so being the team doctor for the Whole Foods team was pretty important, not just for your people, but for all of us. So thank you for that on behalf of everybody listening here. I love what you said about listening and hearing and educating. I think there's something deeply human, that desire to know and to be known. And it sounds like the philosophy that you've taken at Whole Foods really speaks to that innate human desire to know and to be known. Mm-hmm. You've chosen to navigate the healthcare landscape a little differently, a little non-traditionally than some other employers, than most other employers actually. Can you share how your approach to both working with health plans and building your own? How did you decide what was best for Whole Foods, and how did you get there?
Yeah, this question comes up a lot, and I want to make sure I start it sort of at the highest level. I don't want to make sure anybody hears that I think there's one best health plan for all Whole Foods Market team members. As a provider, you want as many quality care options as you can to present to the patient, all those great care options. You've sort of triaged them for the patient, and then you work with them to decide what's appropriate for them. So in certain markets and growing, we have two plans to allow our team members choices and let them decide what's best for them. Anybody's got to be invested in their own healthcare journey right from the beginning. Choice and buy-in. You know this, Jim, as well as on the provider side. Choice and buy-in is key. You've got to have that buy-in from the patient to get real success. So the health plan that best serves our team members is one that best supports their unique and individual patient-provider relationship needs. The plan that allows them to find quality providers and then provides them enough time to build trusting and healing relationships and supports their problem-solving work together. The plan that will provide them enough time and resources to do today's work today. Take care of the problem today when they need it. We all talk in the industry about downstream costs and reducing that. Well, how about we start by optimizing strategies that allow providers and patients to work together to do today's work today? So as we were developing our primary care model and learning all these lessons and realizing how well it landed with our team members, it was harder for the larger payers and plans to customize completely and quickly, nimbly what we needed, as well as account for and understand our culture and our company. So we built our own. We call it the Whole Health Plan. We went out and built a health plan around a whole person care and evidence-based care plan. Clinically, providers know that supporting the human body is one of constant maintenance and proactive care. You're always trying to optimize, helping each person to live their best lives given the deck that they've been dealt. We divide that up as clinicians into 5 preventions, and I like to use those a lot. So the first is primordial prevention, which we all now know as the social determinants of health. What socially can we do to optimize health? And then there's primary prevention, of course, avoiding illness altogether. Then secondary prevention, detecting diseases as early as possible. Those who feel well, but maybe have some underlying conditions, catching that early. Tertiary prevention, reducing the effects of disease, once established. And then quaternary prevention is sort of a newer one, protecting those with disease from unnecessary harm or harmful medical interventions. So Whole Foods Market's previous wellness benefits and risk strategy was not whole. It wasn't holistic in a sense. Like most companies, we had sort of a predictable human journey with an unpredictable and sort of uncoordinated response, sort of compensation and benefits and workers' comp, all taking care of the same human going through the same journey, but looking at it from different perspectives. So when we started to look at how to help our team members at every level of the human journey, we sort of accepted the reality that the healthcare system and therefore health plans are certainly mainly set up for secondary and tertiary prevention. That's the sweet spot where most of medicine's been set up. Find and treat, find and treat. So at Whole Foods, we're a community of people who want to be well. We want to not only find and treat disease, but prevent it altogether with healthy lifestyles. So we not only created our own health plan, but we began to find ways to seamlessly integrate it into the entire proactive preventive journey, that entire journey. So how can this health plan benefit secondary and tertiary prevention? How does the whole health plan optimize secondary and tertiary prevention strategies, link more seamlessly with wellness strategies and care, those primordial and prevention? So it's easier when you understand this more holistically and have a deeper level of control of all the solutions, if you will, the health plan, the wellness. We've got, really good control of those and can pull levers when we want. And the whole health plan does help us do that a little more nimbly. So to summarize, we can launch our care strategies for musculoskeletal and behavioral health needs that work from primary to quaternary prevention, seamlessly link the wellness EAP and benefits journey, and then quickly, get data back to evolve it, optimize our holistic approaches. And I feel like we can better take care of the patients, the team members through that approach. And one of the most exciting things through this whole health plan design has been our new relationships, our direct to employer, our tight relationships with providers like yourself or local health systems, where we can scale these whole person, whole health care strategies without doing it ourselves. We can use health plan strategies or partners to partner with local communities, local providers who are already doing the good work.
Yeah. Well, Ren, I think of a quote by Daniel Burnham, an architect here in Chicago at the turn of the century. He said, make no small plans if they have no power to stir men's blood. And starting your own health plan when you found that the traditional options maybe weren't optimized for your philosophy, I would count that as no small plan. So congratulations to you and the team for being able to pull that off. And I know it's a journey of continuous improvement and learning, but well done. Part of that strategy, I believe, just based on some of our interactions, has really relied on digital health. Can you talk a little bit about not just specific to Hinge, but just digital health in general, how technology has played a role in supporting the whole health plan?
Yeah, it's been key. So I define quality healthcare through the 3 A's, Jim. You know, I've talked about this before in this order, by the way: availability first, affability second, good bedside manner, and ability third. So availability, digital health has evolved to become easier and more convenient. There's even work to start to link some of these services for even easier access. So there's this sort of push towards access, convenience. That's the first A in quality. And affordability. I mean, sometimes some of my partners and I joke that affordability may be the fourth A, but I'll put that into the first A of availability. It's got to be affordable. And I think the virtual, offerings, that model can take care more affordably to employees or patients or to any individual looking for access. Affability, quality providers in the virtual space understand that tech should support the human relationship. You and I have talked about this before, that human relationship and endeavor not be the endeavor. It's a means, not an end. And I believe that this mode of communication, relationship building is good for many, not all. It's good for me. I like it. It's a quality choice and it's an option, right? It's another tool in the tool belt for our team members. And then ability. Virtual providers are recruiting some of the best new talent and quality care providers. It meets the needs and lifestyles of those in the medical field and the care. If it works and you can provide the quality care, I mean, it's more available to providers as well. So I think it meets the 3 A's of quality. And so we're looking to leverage that win strategically and clinically appropriate, evidence-based into the care and access to care for our team members.
Yeah. I think that, excuse me, I think that's right. I think the pandemic may have accelerated things, against our will in some ways, but I think it also revealed the huge opportunity that technology can play in providing those 3 A's or the 4 A's for our members. Just for the audience, you do have the opportunity and the ability to ask questions in the chat. Feel free to ask any questions. We'll do our best to get to a couple of them here before our time concludes. But Ren, from your chair, you get the advantage of seeing a lot of solutions. Some are probably pretty impressive, others maybe less so. What are some of the more impactful innovations that you've had the privilege of seeing in the healthcare landscape today? And how do you think those can be applied and replicated across organizations, geographies, audiences?
Mm-hmm. I would say the most impactful to me has been the digital world beginning to understand the clinical journey, that primary, secondary, tertiary preventions, obviously most, and linking that journey we're all on. We're all, Jim, I hate to say it, we're getting older, buddy. So we're all on that journey together, linking that convenient virtual experience in the palm of my hand. I can start off by feeling good and maintaining my body through proactive approaches through digital health. If I need further help, these providers now are taking the proactive and linking the reactive to it. I can just raise my hand and say, look, I'm hurt, I'm in pain, and ask for help. And then when they can help me get better, and then when I'm better, it just cycles right back conveniently to someone now that understands me even more deeply and can help me prevent this from happening again, all conveniently, right? That availability. The replicability across institutions, I think first comes from an acceptance of the clinical journey by all employers. I really would, encourage employers to not make healthcare providers fit their clinical care into the benefit strategy. Rather, start by find out what providers need to better support your employees and then build around that. Of course, maintaining a relationship and a win for all through fair pricing is also required. That's the win for everybody, right? Is that dialogue. But really working with providers and really understanding what the needs and the care journey is and really defining strategies. That's where I think this becomes more replicable, if you will, is when more employers start to join with us and accept that journey and really lean into that. The replicability across audiences is the understanding and ability to adapt your approaches to unique whole people. I think when virtual or digital health can really take in quickly, efficiently, whether that's, putting in data or the human experience, all comes together conveniently to get to know me better and my individual needs. It will then be able to scale more. It will be more applicable to more people. And that's also taking into account the human relational element, and really keeping that as key. Once again, in healthcare, tech should not be for the sake of tech. It should be to optimize creating trusting and healing relationships between a provider and a patient.
Yeah. Trust is one of those currencies that we use in living our best and healthiest lives. Ren, when you and I were on stage together at Movement, which is our annual client conference in Chicago here a couple months ago, you shared some really nice insights into the MSK space. MSK is musculoskeletal, and curious. You said it was one of the top 3 components in your clinical strategy. Maybe you could just share a little bit about what you found. How does MSK impact the Whole Foods team as the team doc? How does MSK Health impact how the team plays from whether it's productivity, sick days, cost of care, or otherwise? And how do you ensure that you are supporting that team in that MSK journey?
Yeah. You heard my story at our last, talk together about, the gentleman that just got up probably 15 different times while stocking shelves to help a customer. I want to send out, if I may, an appreciation to all team members who are working in the stores. I've done it. It's quality work. It's fun work. Working with them is amazing, but you do feel it at the end of the day on your body. So, um, you know, pain and suffering affect our whole being and our whole lives when we think of ourselves as whole people. So if we want our team members to live whole, then we need to walk life's journey with them and try to help them reduce pain as much as we reasonably can. It's a goal. Everyone loses when someone in their community or on their team is suffering and in pain. So a need like that, should be addressed quickly and efficiently. So you cannot listen to your patients. You cannot serve them if you cannot listen to your patients. You cannot serve them. If you cannot serve them, you cannot empower them to live whole. So, you know, the way we do it today is first start with communication strategy and really trying to create some sort of relationship with 100,000 team members to go and get easily accessible care and help. Of course, non-emergent, but find and navigate their way through all the offerings that we have for them. And then we work with our digital health partners to communicate to our team members too. The way we use digital health is making it convenient, accessible, but also then leveraging the experience that the quality digital health providers have with how to talk to those in need. Right? You've learned those lessons. You know how to get them to work with us and navigate to the correct level of care. So it's really actually an internal strategy, but also an external provider partner strategy in a good significant piece of it.
Yeah. Well, musculoskeletal obviously is near and dear to our heart here at Hinge, and we could talk about this all afternoon. But in the interest of time, we'll get ready to wrap this up. And as we do, again, I'd love to hear maybe from you any predictions. You're kind of willing to put yourself out there, and I know there's things you can and can't say. Whether or not we're going to see one medical stores open up in Whole Foods, or any other predictions that don't have anything to do with Whole Foods. Maybe share, one or two predictions that you could make for our audience for the future of employee benefits and health.
Yeah, well, first of all, I mean, technology is big. So I'll start there. Whenever people think of the future, they think, what does technology sort of mean? The older I get and the more I try to help people, the more I like to lean into finding balances. I don't know why balance just keeps coming up. I think the future will be a deeper understanding and a better balance of the human relational aspects of care with technology and virtual. I think the technology will more and more support the human endeavor. Caring for humans requires that human connection to be completely holistic. I think there will be a deeper understanding on the care side of the embodiment or the wholeness of people, the holistic nature of us, and really taking into account the mind and the emotions and the wholeness. I think we've sort of teased out body parts. We've got liver doctors and kidney doctors and heart doctors, and we've sort of, because that's been a good way to get and know the human body. But I think the future in care is the understanding that all those are as interrelated. You cannot tease out, you cannot separate the heart from the liver, the lungs from the kidneys, or the brain from anything, and understanding the wholeness of who we are. On the employer side, I think it's a tighter relationship between employers and providers. We are the patients. It's funny because we think of employees and employers, but actually we're all employees. I'm an employee of Whole Foods, leadership's an employee. We're all together in this. We're all a community that needs care. And I think the future is that the real acceptance of that and the understanding that we need to work together and tighter with providers.
Yeah. Well, Ren, thank you. We heard a lot today. We heard about this concept of listening and hearing and really knowing our people so that we can engage them and educate them in with trust and community. I love the 3 or 4 A's: availability, affability, ability, and maybe affordability as the 4th A. We learned about that continuum of care from prevention, all the way through to folks living with whether chronic conditions or serious diseases. How do we help protect them and support them to the greatest degree possible, maybe in a more conservative and less costly fashion? And we learned about when you don't find exactly what you're looking for, is there an opportunity to go out there and through partnership build something that challenges the status quo and hopefully builds a healthier world in the process. So I think you gave the audience a lot to think about. And I sure appreciate it. Thank you for taking the time. Again, everybody, Dr. Ren Brown, Vice President of Medical Affairs and Clinical Strategy at Whole Foods Market. Quickly, Ren, if people want to hear you speak or get more of the religion that you're sharing here, where might they find you between now and the end of the year?
Yeah, I'm on preaching the gospel of whole health, right?
Right.
So, I'll pop up here and there. I got an event in Chicago, I think, at IBI. So I'll be around, but they can also just contact me, reach out, LinkedIn, wherever they want to ask. I'm open. We need partners. Jim, thank you for bringing that up, by the way. I'm looking for partners in this. We are one employer doing work, but we need partners, and we need collaborators and other employers to join with us and explore, because together we're stronger. So find me at different conferences and online, LinkedIn and through Whole Foods email.
Well, great. Well, Ren, again, thank you. Given the environment that we're in, the economic uncertainty, inflation, the ability to partner, not only to build a healthier world, but to drive a healthier bottom line. They're not mutually exclusive. I think you're a great example of that, and I appreciate it. To our audience, thank you for taking your time. Thank you for joining us today, either live or later. I hope you've enjoyed Pain Points, the inaugural launch of an ongoing series where I'll be joined by leaders across industries, from retail to travel, manufacturing, and beyond, again, to explore this intersection of healthcare, technology, and innovation. As you heard Ren say, technology is not an end to itself. It's a means to enhance our humanity and, again, help us build a healthier world. Follow Hinge Health on LinkedIn for updates on our next episode, our next guest. Until then, I'm your host, Jim Pursley, and we'll see you next time on Pain Points.